You make reference there to the National Audiology Review Report of 2011. I presume the purpose of that was to assess the number of people with hearing loss who require help. But has there been one since, or how often should they be carried out? I mean, is the reason it was carried out in 2011 and not since, should it not be more frequent to kind of inform what services are required?
I suppose that report was carried out by the HSE. Mm-hmm. It was quite focused on HSE services, if you like, and provision at the time. One of the key pieces of information, if you like, in the review was that 8% of adults in the Irish population have a significant hearing loss and should receive audiological support and intervention. So that was a key piece of information. That's where the 300,000, slightly more now with census and an increase in population. But the recommendations of the report were very much focused on, the provision of services by the HSE itself. And some of those recommendations have been carried out. Okay. But obviously the HSE is only providing services to people who have medical cards and children under the age of 18 who have hearing loss. So the issue here is, and it's been traditional even in terms of parliamentary questions and so on, around audiology, that it focuses on the HSE's audiology waiting list, for example, a lot of the questions. And a lot of the replies are kind of confined to issues around the HSE's provision of audiology services, which are problematic in the main. The problem there is the persistent waiting list that we've already mentioned. But what's not so well known is that actually 70% of audiology services are provided by the private sector, where there's very little regulation or oversight. In fact, anybody can set up an audiology service and prescribe hearing aids. There's nothing in place to say you need certain level of qualifications or your facilities should be up to a certain standard. And the only kind of, if you like, oversight that's there is on the part of the Department of Social Protection in terms of the hearing aid grant, where they do have a list of approved providers who must be members of the Professional Association of the ISHA, the Irish Society of Hearing Aid Audiologists. But that's it. And in fact, last year, we gave you that figure in our opening statement. 28,000 people made, almost 27,900 something, made a hearing aid claim. And that equates to 26 million in value or over, right, between 26 and 27 million. So the state, through, albeit it's a demand-led and it's PRSI related, so it's a social insurance scheme, the state is investing more, I think, because I don't have the exact figure for the HSE, in audiology kind of support via the Department of Social Protection rather than the HSE. So I don't think that's well known, but it's important, we think, because that pathway is the one where people will often want to go and get support but simply can't afford it. They don't have the money in their pocket.
Yeah, because I know you're saying in there that many people only get hearing aids as a last resort, and we think maybe it's because they don't want to be seen as getting older or whatever it is. Because we see people need corrective eyewear, they get glasses, and but is it the cost that is actually more of the deterrent than the actual? I mean, it may be both, which I presume will be addressed in a national hearing plan. Because I mean, if the fact that, for example, dementia can be caused by hearing loss is not a well-known fact. I know it was raised here at the Alzheimer's Society of Ireland a few weeks ago. But I mean, if information like that was in the public, more people might be inclined to have their hearing checked and addressed. But at the same time, is the cost still going to be a huge deterrent for many? Even like, how much does the grant or the PRSI payment cover?
Yes, Deputy. So you've touched on an important point there, and it's a little bit complicated, but happy to go into it. We'd been campaigning as well for a number of years prior to 2020, and for an improvement in the terms and conditions of the hearing aid grant. So at that point in time, the hearing aid grant was €500, a maximum of €500 for one hearing aid, or a maximum of €1,000 for two hearing aids. And it also had the proviso that the maximum grant payable was 50% of the value of the hearing aids. So at that time, for example, some what we call basic or level 1 type hearing aids might have been in the range of €1,400 to €1,600, and somebody would get a grant then of €700 to €800, and they'd have to pay the balance themselves of €200 or €300. So we were aware, very much aware, that this was cost was a major barrier for people. And at that point in time, 3.5% of hearing aid claims were for those level 1 basic hearing aids. That 3.5% is an important figure. So another thing I just want to mention is that, believe it or not, prior to the financial crash, the hearing aid grant was a maximum of €760 per hearing aid. So it's significantly lower than what it was in 2006 or 2007. So in 2020, due to our efforts and with the Department of Social Protection, they had to bring forward a report under the Social Welfare Bill on the affordability of hearing aids. And that report was published in August 2020. The department's report, in its wisdom, assessed, that cost was not a significant factor. So they didn't want to increase the grant, but they removed the 50% tariff. In other words, everybody could claim €500 for a hearing aid, irrespective of whether it was below €1,000. So what happened subsequently was that the hearing aid manufacturers all introduced new level 1 hearing aids at a cost of €1,000. So effectively, somebody who had eligibility for the PRSI hearing aid grant could pop along and get hearing aids free with PRSI, was the catchphrase in some of the advertisements. Now, as a result of that, when that change came into effect in May 2022, every month since then, there's been an additional 1,000 people. It's been extremely consistent. An additional 1,000 people, an extra 1,000 people every month claiming that grant. And also, 28,000 claims last year. Since the change, instead of 3.5% of people getting the level 1 basic hearing aid, it's now almost 29%. And that's an issue for us in terms of, the appropriate and quality provision of hearing aids, the right hearing aid for the person, right? So why do we think that's happened? We think it's happened for two reasons. One, there's a considerable number of people who've come forward because they had no money in their pocket. They have no spare money. Think about what's been happening with inflation and so on in the last couple of years. And people are going in and saying to their provider, I'm here to get the free €1,000 hearing aids. That's because I have no money. And also, we believe that a considerable number, we don't know how many, but anecdotally we know it's significant, a considerable number of people who are on the HSE audiology waiting lists. People in their 70s and 80s who are being told they'll be waiting up to 3 years for a first appointment. But they also have PRSI eligibility. So those people, we think, a considerable number, are electing to go along and get the free hearing aids until their HSE audiology appointment comes up. So this is where we're talking about the duplication and inefficiency in the system, and the fact that we think people are not getting the right hearing aids that are fit for purpose. A national hearing care plan would include recommendations around, perhaps instead of having just one single level of grant, but perhaps a two-tiered grant system, that people could get the appropriate hearing aids that they needed.